Aloha and welcome to Adventist Health Castle. I'm Kanoe Gibson-Nita and I want to thank you for allowing Castle to take care of your health needs. By now, you've already received your patient handbook that contains information about your rights, responsibilities, and safety tips. This video is a complement to that handbook and will help you to know what to expect during your hospitalization. First, let's talk about our top priority, patient safety. Remember when you were young and your parents would always remind you to wash your hands before eating or after using the bathroom? Well, turns out they were right. Germs spread pretty easily through unclean hands, so every staff person who walks through your door should be using hand sanitizer. If you don't see them rubbing their hands together, remind them that it's for your safety and theirs too. We even teach our staff to clean their hands when leaving your room. We call this gel in, gel out, and encourage your visitors to do the same. Gel in, gel out. To ensure accuracy, we will be checking your armband every time we give you any medication or do a procedure such as drawing blood. We also label any specimens in your presence before we leave. We'd never want to give you someone else's medication or confuse blood samples. It's very common for patients to fall when they are hospitalized. Regardless of age, even if you've never fallen before, being in the hospital makes you vulnerable to such an incident. And we definitely don't want that to happen to you. Many factors can contribute to a fall, including being sick, feeling weak, new medications, or even getting tangled in the tubes and wires you're connected to. So even if you think you're able to get up on your own, wait for one of our nurses to assist you. Castle's fall prevention program is one of the best in the nation, and your nurse will review it with you later. Don't overestimate your strength and balance. Call, don't fall. You may be surprised to hear that the most important member of your treatment team is you. So it's vital that you participate in discussions about your care. And there are several ways to do that. First is the bedside shift report. This is how each shift begins and ends for our nurses. Before heading home for the day, your nurse will give a bedside shift report to your new nurse regarding what happened while they were on duty and what should take place over the next shift. Please speak up if you have a question, anything to add, or if something doesn't sound right. Every hour, nurses and nursing assistants will be checking in on you. We call this rounding. They'll be there to discuss the 4 Ps. Using the pain scale, indicate what pain level you're experiencing, and our staff will do their best to help you manage it. If you need to go to the potty, hourly rounding is the best time to do that. Remember, don't try to do it on your own. Your position in bed will be adjusted at this time as well. We want to make sure you don't develop any bed sores. The last P is plan. During rounds, you'll be able to review any pertinent issues in your care plan. By knowing what to expect during hourly rounds, you can partner with us to meet these needs. This is also the perfect time to ask for help with anything else you might need, so you don't have to wait for the next round, such as refilling your water or adjusting your curtains.
Thank you, Shannon.
A nurse leader will be rounding on you once a day to make sure everything is going well and that we are staying true to the We Promise poster. If anyone or anything is falling short of our standards or your expectations, please share that with the nurse leader so those issues can be addressed with the rest of your care team right away. We'd love for you to share any great news with our nurse leader too. Is someone going above and beyond in their service to you? Let us know so that we can recognize them.
These are our patients.
Your doctor will also round on you once a day, but it could vary any time from the early morning to the late afternoon, depending on when test results are received and the urgency of the needs of any other patients. You should always have a call light near you, but please reserve its use for emergencies only. All of your other needs will be addressed during your hourly rounding. Your nurse will discuss the kinds of things that you should use your call light for, based on your condition and needs. Another helpful communication tool is the care board. Each room has one to ensure that you and your care team are on the same page. The first column is everyone on your treatment team, including you and your family. Each discipline wears a different colored uniform to help you know who they are. For example, RNs wear navy blue, whereas nurses' assistants wear teal. You can find a uniform guide on the back folder of your handbook. The second column on the care board will help you learn about new medications, list your goals for the day, upcoming appointments, or any tests you have scheduled. The last column helps us individualize your care by listing your priorities like pain management and preparing for discharge. All of our patients have some worries or concerns that we may not be aware of, so please don't hesitate to tell us. We're good listeners and do our best to put ourselves in your shoes and see things from your perspective. And the more you tell us, the more we can help you to feel better. Remember, you are the most important member of your care team. Your communication with the other members of your care team will help us help you. Nowadays, hospital stays are much shorter. Our goal is to address all of your inpatient needs so you can return home as soon as possible. Most people, however, will need continued treatment as outpatients. This does save you money because insurance companies will not pay for inpatient services that can be addressed on an outpatient basis. We begin planning for discharge on day 1 of your hospitalization, so please let us know if you have any concerns about where you will go or who will be available to assist you. We will write the anticipated discharge date on your care board and update it each day as we meet with you and your doctor. Once your doctor has written discharge orders, your nurse will review the education you have been given during your hospitalization, along with the specific instructions on what to do after you leave the hospital. We also want to make sure that there are no delays in obtaining the medications that you may need immediately after discharge. So our pharmacy will bring your medications to you in your room and explain how to take each one. Later, when these medications run out, you can renew your prescriptions at the Ko'olau Pharmacy on the Castle campus or the pharmacy of your choice. Once you leave the hospital, we want to continue to partner with you in your care to prevent a readmission. The most common cause of readmissions are not following up with the doctor appointments or not taking medications correctly. If you need help with either of these, let your nurse know. Soon after your discharge, you'll receive a phone call from one of our nurses to make sure everything is going as planned and to help you resolve any problems you may be experiencing.
Have a great day. Bye-bye.
Thank you again for entrusting Adventist Health Castle with your medical needs. We know that being in the hospital can cause anxiety, so please let us know how we can better partner with you in your care to make your time with us more pleasant. On behalf of Adventist Health Castle, I'm Kanoe Gibson Nita. Aloha.